Ever find yourself staring at the ceiling in the middle of the night, not because of a bad dream, but because you need to use the restroom? It is a surprisingly common experience. Yes, waking up frequently to urinate is a very common issue, and it has a medical name, nocturia. This condition directly impacts your sleep quality and overall daily well-being. There are several reasons why your body might be prompting these nighttime bathroom trips, and understanding them is the first step toward better sleep. One key area is the natural production of antidiuretic hormone, or a DH, which normally reduces how much urine your kidneys make at night. If your body does not produce enough DH, or if your kidneys are not responding to it properly, you will find yourself needing to urinate more often during sleep. As we get older, our bodies naturally produce less DH, and bladder capacity can also slightly decrease, which makes older adults more susceptible to nocturia. Lifestyle choices also play a significant role. Consuming fluids, especially caffeinated drinks like coffee or soda, and alcoholic beverages close to bedtime, acts as a diuretic and greatly increases urine production. Certain medical conditions are also common culprits. For example, an overactive bladder can cause sudden, strong urges to urinate, even at night. Urinary tract infections can lead to frequent urges and discomfort. Chronic conditions like diabetes can increase overall urine production, while heart failure can cause fluid retention that is released at night when lying down. Even conditions like sleep apnea can sometimes contribute to nocturia. For men, an enlarged prostate, also known as benign prostatic hyperplasia, is a very frequent cause because it can block the flow of urine and irritate the bladder. For women, hormonal changes during menopause can affect bladder strength and control. It is clear that nocturia often results from a combination of these factors. To start addressing these nighttime awakenings, you can implement a few practical strategies right away. One key step is to carefully manage your fluid intake, particularly in the hours leading up to bedtime. Aim to reduce or eliminate alcoholic and caffeinated beverages at least 3 to 4 hours before you plan to sleep, as these act as diuretics and stimulate urine production. Try to drink most of your daily fluids earlier in the day. If you notice swelling in your legs or ankles during the day, which is known as peripheral edema, elevating your legs for an hour or so in the late afternoon or early evening can help your body process that extra fluid before you lie down for the night, preventing it from being released all at once while you are trying to sleep. Another incredibly useful tool is a bladder diary. For a few days, simply record what you drink, how much you drink, and when you urinate. This detailed information can reveal patterns and triggers that you might not be aware of, providing invaluable insights for both you and your healthcare provider. If these initial self-help measures do not significantly improve your symptoms, it is always a good idea to consult with your doctor. They can perform a thorough evaluation, rule out any underlying medical conditions, and discuss various treatment options tailored to your specific situation, ensuring you get the right support. An often overlooked aspect is pelvic floor health. Strengthening these muscles through targeted exercises can improve bladder control, especially with overactive bladder symptoms, reducing the urgency that can wake you up. Your doctor might also discuss timed voiding strategies, which help train your bladder to hold urine for longer periods during the day and night. These practical approaches, combined with understanding the role of antidiuretic hormone, can make a real difference in managing your nocturia. Ultimately, recognizing that frequent nighttime urination is not just a nuisance but a symptom with identifiable causes empowers you to take action. By understanding the why behind nocturia and exploring practical how-to strategies, you can work towards improving your sleep quality and regaining the restful nights you deserve, leading to a much better quality of life.